everyone, I'm Nicole, an occupational therapist, and together with Stephanie, the physical therapist, we make up a PT and OT duo, the Note Ninjas. We help other therapists, assistants, and students come up with different treatment ideas and documentation in order to help with improving better patient outcomes. So today I'm going to be showing you a fine motor activity that's also a cognitive task as well. So I love, these are bananagrams, but you can also use Scrabble pieces as well. If you don't have these game pieces, you could just use a Post-it note, a piece of paper, index card, whatever, write the letters on there, and then have the patient do the word sort. But we love it because this helps really with the fine motor coordination, especially the intrinsic muscles of the hand, that pincer grasp. So it's really great activity to work on. And then it also includes the cognitive aspect as well, because you have to do some spelling and problem solving, also some visual scanning. So for individuals who are struggling with some visual neglect or visual impairments, we can work on scanning throughout an area. So I don't like to use I don't want to dump out the entire letters. You want to base it on the patient's skill level. So I just try to take out a few letters at a time. And first I'll do some scanning to see, all right, what can I spell out? Right off the bat, I see a B-A-B-I, baby, okay? So there's one word you can spell out, but just, gliding these, picking them up, works so many fine motor coordination, and it works on cognition as well, visual. So also it's a good sensory activity too, especially that's why I do like these pieces versus if you're just doing an index card, because they are a little engraved. So there's some texture to them as well. You can also stack the letters to make a word. So let's do quilt. So I'm gonna do Q-U-I-L-T. So we're stacking. It's kind of just a different variation of the activity. But as you can see, there's a lot of different variations you could do with this. You could do it standing, you could do it sitting. You can stand here and pivot to work on more motor skills and some trunk rotation and mobility. So it's really whatever you want to make of it. Just make sure that you are highlighting the skill that you are providing in your notes. So instead of focusing on all the details of the activity, make sure that you're highlighting your skill. If you're doing this as a fine motor task and cognition, then make sure that you're documenting that, okay? So you don't just say that I'm doing a bananagram activity, patient got 3 words out of it. You want to make it a little bit more skilled and add in the technique that you're providing. If you gave them any verbal cues or visual cues, maybe you gave them tactile guidance and whatnot. So for more treatment ideas and documentation tips, make sure to follow us, the Note Ninjas.